Welcome to the Wealth is in the Details podcast. In this podcast, financial planner Peter Raskin helps families and business owners understand and prepare for their wealth journey. Along the way, thoughtful and detailed planning can provide clarity and confidence as clients confront a multitude of financial decisions. Listen in as Peter shares stories and insight into people's wealth journeys. Now, let's get into today's podcast.
Hello and welcome to Wealth is in the Details with Peter Raskin from Raskin Planning Group. Good morning, Peter. How are you today?
I'm great, Eric. How about yourself? Happy July 4th weekend?
Yes, I've got all my fingers still, so I'm pretty excited about that.
Yeah, good.
I'll tell you, on this podcast, Peter, obviously we talk about financial well-being, financial wellness. You've brought so many topics to the table, but often you sprinkle in guests and you go off topic a bit, which is fun too. And we've had a travel specialist, we've had a wine specialist, you even brought in a moving and organization professional, which was just fantastic. I really enjoyed that one. It was very interesting. And today you're talking about healthcare, and you've got a special guest on the show today.
Yeah. There's a common thread to all these topics, and to me, it's all about wellness. And life's a balance, and wellness, and certainly, financial, but also physical and emotional wellness. Those are important features as well. So being, financially, physically, emotionally healthy is really what's most important to me. And I try to relay that to our clients and listeners of the podcast. So today I'm really honored to have a special guest, and it's Dr. Ned Legare. He's actually my primary care physician for the last 20 plus years, and we'll be talking about his approach to wellness. Most importantly, Ned's chosen a professional path that allows him to offer best-in-class internal medicine for patients in the Boston area, but also gives him ongoing professional and personal satisfaction. Ned's affiliated with an organization called MDVIP, which is a concierge primary care medical practice model. And Ned, thanks so much for joining us today.
Peter, it's great to be here with you.
Great. Before we get into our topic, I want to extend my gratitude and thanks for all those frontline medical workers that have done their best in an incredibly difficult period of time during this, global pandemic. And while the crisis seems to be waning here in at least our part of the United States, it's still raging in the other parts of the world. And I won't have you speak for the entire medical profession, but just tell me what it's been like for you both personally and professionally over the last year and a half.
It's been extraordinarily challenging. It's been extraordinarily rewarding. And it takes me back to a time earlier in my career when I was an active duty Army physician. And it felt a lot like those days where there was a threat, there was an enemy, and there needed to be a great strategy. And there was a mission that required a lot of coordination and a lot of dedication. And it was really something, Peter. I think really only the last 90 days do most physicians who were in that fray feel like they could take a breath.
Well, again, thanks for all that your profession has done for all of us. And I know the battle rages, and I know there's a long way to go. But really, thank you, and thanks to all those that care as much as you do. So Ned, spend a few minutes telling us about your journey to medicine. I just think it's always interesting to hear where people are coming from and how they got there.
I think back on my journey to become a doctor now, 32 or so years ago. I grew up in southeastern Massachusetts, went to a parochial high school, Bishop High School, and really grew up in a working class family. My mom was a second grade school teacher, my dad a salesman, and my brother and I had very common interests as we went through high school. I enjoyed leadership, I enjoyed athletics, I enjoyed a challenge. And most importantly, I think people are different, but I think most people who go into medicine historically and still today really go into it for the right reasons. They like to help people. And 32 years later, I like a challenge and I like to help people. And I studied hard in high school. I went to Notre Dame, University of Notre Dame. I had a great 4 years there. And I realized that I had a daunting bill in front of me. Someone would come knocking on the door someday to collect. And I was lucky enough to win a full scholarship through the United States Army. They give 200 scholarships away. They still do yearly, the three major branches, the Air Force, the Army, uh, and the Navy. And I got outstanding training in the United States Army. I spent 3 years in Denver, Colorado, where I trained and became an internal medicine doctor. I spent a year at the United States Military Academy at West Point, which was a wonderful experience and one that I have taken with me throughout my life. And I spent 2 years supporting special forces operations based out of Fort Devens, Massachusetts, and Fort Drum, New York. When I left the Army in 1995, I was an Army major, and I circled back to another Notre Dame graduate who was practicing at the hospital that I had my best experience with in training, which was Newton Wellesley Hospital in Newton, Massachusetts. And he, Dr. Bill Holgerson, and myself formed a group. We grew that group to 15 doctors, more than 35,000 covered lives. And I did that until 2011, where I went into a new model of medicine.
Yeah, when I first started working with you, your internal medicine practice was very well established and super busy. But I always felt like I got great service and certainly great advice. And then you change your approach to serving patients. And I know why you did that because you've told me. But tell our listeners that why you made that change and how you did it. And what was your intention?
I'll start by saying it was honestly one of the most courageous moves of my life. It was the right thing to do at the right time. The reason I say that is that my practice had grown too large. I was caring for 4,200 people. I had 4, sometimes 5 physician assistants working under me. There were weeks that would go by that I honestly wouldn't see my sickest patients because I had no room on my schedule. I knew it was a matter of sands running through the hourglass before something bad happened. And I knew that I was feeling burnt out through that model. I thought I was giving excellent care, but I knew I could give even better care. I knew I could be a more complete physician for my patients. And I made a decision to have the courage to explore this model. My other option would have been to go into industry because I felt like I couldn't really continue at that pace. So to go on, I did a little research, and at the time there were 2 physicians in Boston who were practicing in a retainer model, quote unquote, concierge care. And I really did a very thorough due diligence on the entire process, Peter. And I came to the fact that those patients who wanted to come along with me for a modest monthly retainer would enjoy, benefit from, and travel a journey with me on the kind of medical care I really knew I could provide and that I really wanted to provide, and the kind of care I was only willing to provide.
Ned, what makes the industry, the medical profession, what the large numbers of patients that you needed to serve? What is it about our medical industry that got you to that point?
Got me to the point of having so many patients?
Yeah.
Yeah, I think it's a couple of different things, Peter. I think we still practice in a demographic that seeks medical care universally. I think there was an issue of reputation, and I think there was also an issue where I just couldn't at the time say no. And as one matures, this is a life journey, and I'm sure you can say the same thing in your life, but as you move through that journey of life, the decisions that you make sometimes become more refined. For me, one of those decisions were the ability to say no. And I've just started really as a person to be able to say that. And at the time I couldn't. That's why my practice built to 4,200.
Yeah, it is hard. You want to you want to do what you do well, which is to help people and serve people, and you want to keep on saying yes. Yeah,
Yeah,
we can do that.
it's hard to do that, particularly when you have that many people. So this model was really was enticing. When we launched in the spring of 2011, there was a lot of mixed reviews. And I remember one of my patients very well, a Boston Globe writer, wrote a op-ed on the model. And clearly in the op-ed, he had to make a decision whether he was going to buy a new skull to go rowing on the Charles River or pay a monthly retainer to me to be his private physician, concierge doctor, and he chose the skull. And I thought that was pretty whimsical, but it really, it sort of was emblematic at the time of how much of a lightning rod this was, because it was so new in the Boston area.
Yeah. Well, why do you think it was such a lightning rod? I mean,
Well,
I know
yeah, I can understand historically why it was. It could be perceived as being a bit divisive. It could be perceived as being a bit elitist. It could be perceived as not being the kind of care that represents equity in our society. So for those reasons, I think in part that is why it was such a hard thing to move through. I know retrospectively, it was the way I was able to stay in medicine. And honestly, it has been very satisfying, because I've gone from 5 to 10 minute office visits to sitting with my patients, working through my patients' issues with them until they feel as though they are fully vetted and that we have a plan to move forward.
Yeah, I know personally, I felt that way. That frankly, I always felt you gave me the time that we needed, but since the change, it's been unfettered. It's been generous, and in those conversations, you're able to deepen the relationship, and that's what medical care is all about. It's a relationship business, I think.
I think you're 100% correct. I think when you get sick, God forbid you get sick, but when my patients get sick and they're admitted to the hospital, myself and my colleagues are the very rare physicians who will show up at your bedside today in an acute care hospital and make sure you understand what's going on and help, if you will, broker the proper care for you by interacting with the medical subspecialists and hospitalists who are providing that care. And I think that is another really solid and important point.
Yeah, I think so. Just this podcast, we call it "Wealth is in the Details," and if you're not spending time with your patients, it's hard. I would think it's hard to dive into and focus on those details of their medical care, which is so important.
One of the really privileges of this model is, again, not to speak about you, Peter, but when we talk, I know your story. I know your medications in my head today as I'm talking to you. I know the things that you've had in your past. I know your wonderful family. I know the things that are important to you. And all of those issues, all of those issues play into how well you're feeling, into how well you're doing, and in terms of how long you may live and what quality of life you may have.
Yeah, it's so vital, and I know as you're a patient, it feels good to be held up, and valued, and that's the way it feels. And I'm sure many patients of many doctors feel that way. So it's not to say that it can't be done in a traditional relationship, but I know that's what I've been able to get out of your practice.
And I particularly like the model that I joined. I don't know if you've looked, Peter, but in the greater Boston area, when you look at Concierge Care, which to me, that entire vernacular doesn't sit right with me. I like to feel it's more personalized medicine, and that is how I see it. But when you look at personalized medicine's Concierge Care in greater Boston, the cost differential, have you seen what the cost differential is? The highest care providers in Boston charge upward to $20,000 a year to care for their patients. The mean in Boston is somewhere between $5,000 and $7,000 per year to care for patients. The MDVIP model is different than that. When I look at the patients I care for, I'm honestly telling you, I care for the patients I've known forever, like yourself, but they're school teachers, they're policemen, they're firemen, they're clergy at a price point of approximately $2,000 a year at the monthly cost of less than probably your cable bill. You have somebody that you know that you can count on. This is the 4th of July weekend, this past weekend. Had you called me on Saturday or Sunday and told me that you had an issue, there was something going on in the family, you need to bounce off me, I would have called you back and we would have had a conversation on the 4th of July. There's value to me to be able to provide that care to you because I know you so well and I feel like I'm producing a good product for you, trying to help you, and I get a lot from that. And from you, there's something that the person on the other end of the phone, you've had a long-term relationship with. You know you can count on that person and you know what to expect from that person when you reach out.
Yeah, there's certainly value. I believe very strongly that there's tremendous value here. And when you first introduced it to me so many years ago, I thought about it for a second. I said, yeah, I want to keep on working with Ned, and let's give it a try. It just made sense, and it's proven to be the case that it's been a great model for us, for me and my family. Just to get into some of the nitty gritty of how it works, how does this personalized model change a patient's relationship with insurance or Medicare? How about the networks that many of us are in?
I have to say that was a point of challenge until about a decade ago. And there was a absolute sea change that took place when the major healthcare systems, just speaking for our marketplace, but when the major healthcare systems in our marketplace saw the value of this model, endorsed it, and created within the walls of their institutions similar practice models. Fascinating. When the Massachusetts General Hospital decided they were going to open up a division of private healthcare, which is what they refer to it as, the walls came down. Harvard Pilgrim, Blue Cross Blue Shield of Massachusetts, Tufts of Massachusetts. If there was any point of obstruction to contract negotiation for doctors who were providing a personalized care model, it evaporated. And in today's marketplace in Greater Boston, all of the insurers, without exception, recognize the model, accept the model, and insure for the model.
Yeah, that's interesting. So as far as I'm concerned, as a patient of yours, the insurance company's reimbursing me for our visits, for anything that you order, any of the drugs, the tests, whatever happens, it just is the same. There's no difference.
It's seamless.
Yeah.
It wasn't always that way. There were some wrinkles, but over the last decade, it's become seamless.
Yeah. So you're professional, you're a doctor, but you're also a business owner, and like any business owner, you deal with with challenges. And when I've had business owners on the podcast, I like to ask them to go through what we call a SWOT analysis. And it's where we discuss your business's strengths, weaknesses, and the opportunities and threats that you see coming on over the next 3 to 5 years.
Mhm.
So would you spend just a few minutes talking about these strengths and weaknesses and opportunities and threats?
Sure, I'll do my best. I am a part owner in a small business and have been since 1995. We have employees. We have the same kinds of overhead expense that any small business owner would have. And last year was a perfect example of how a private doctor has to work just like a grocer to make sure that he can make payroll, make sure that he can pay his bills. Last year was a challenging year. Revenues were dramatically down. We were able to thankfully secure one of the government loans. We were able to keep our staff fully employed. We adjusted on the fly where the doctors were in the office each and every day last year. People were sick each and every day. Really kind of a scary year in retrospect. For my small group of people, I care for a total of 600 people. 600 people is the maximum amount of members an MDVIP doctor can have in order to fulfill the obligation of the model, which is to provide care to you when you need it and to provide ample time for you when you come in. So of the 600 plus people that I care for, we saw 5 deaths in our practice last year. We saw several suicide attempts. We saw a lot of sick people. All of this going on with a dramatic decrease in the amount of office visits that we were entertaining. And like any small business, we did our very best to keep our folks fully employed. So you asked me specifically about the strengths of the model. The strengths of the model. The strength of the model, I believe, is the asset that the model produces, which is the care provided by the physicians who provide the care within the model. The strengths are the people who support the physicians providing that care. I think of my assistant, who you know very well, Luann. She is spectacular, Peter. She knows you well. You call her on the phone. She knows exactly who you are. She knows whatever nuance that you have, that how you like things done, what's important to you. She's an amazing strength. Another strength of our model is the educational piece that we provide. I know we have a close tie with the College of the Holy Cross. At all times, we have 3 young people in our office, people who are trying to make their way into medicine. And through an experience that we provide for 3 people at all times, we're giving those folks 2,000 hours a year in direct patient contact, which really bolsters their curriculum vitae. They're a strong part of the face of our practice. Our patients like young, smart, engaging young people. I think they're really part of the strength of our practice. I think another strength is the fact that you can reach out to me 24/7, 365. If you have an issue, I'll get back to you any day. Those same strengths provide the basis of our greatest weaknesses. Unlike a really good baseball team, where if the second baseman goes down, you can pull in another guy out of the dugout, or something happens to the outfielder and you need another outfielder, you carry 6 outfielders. We have 3 doctors in our practice. And our weakness is if something happens to one of those 3 doctors, the business model predicated on shared overhead, 33, 33, 33, is a challenge. It's challenged. The care provided to the patient becomes a challenge. We all need to step up and help each other. I'd say that's probably the biggest weakness, is the lack of depth that we have. But I would think, and you can tell me if I'm wrong, I think that would be probably akin to most small businesses, that provide a service.
Oh,
I like
yeah. I
that.
think most professional services have the similar, that similar strength and that similar weakness. Definitely the case.
Opportunities, gosh, I have to tell you, part of the success of the model for me has just been fortuitous in the sense that I provide the care I provide in the geographic area that I do. You know the area well. It's West Suburban Boston. It has a large group of well-educated, hardworking people who value their health, value healthcare, and value a relationship within that context. Um, you had also asked me about threats. Maybe a bit naive. I had to think a lot about threats. Thankfully, thankfully, our practice has been on autopilot for a little bit here. We're always trying to do better because I know if you're staying in the same space and not moving forward, you're actually moving backwards. You know my great interest, which is preventive healthcare. I really like it. That's not lip service. I really enjoy it. You know my interest around preventing cardiovascular illness. I have a great illness around I have a great rather interest in terms of early detection around cancer. That'll be my next big push over the next several years, is working very hard with genomics that are becoming available to help folks head off cancer before it manifests. So as a threat, the threat is external to myself. The threat is, should there be, again, a major change in the way healthcare is delivered, where this model is revisited because of geopolitical reasons, that would be my principal threat.
Yeah, but I would imagine that because as a primary care practice and your focus on preventive care, the results of your practice, meaning the 600 patients that you see, are quite good. So I would imagine that there's always a threat of legislation and politics getting into into everything, but I would think that the results are there for you.
In healthcare, we have so many metrics. Healthcare has become seamless within the walls. So all the doctors and all of the administrative staffs across the city can see the results. And when I think of my colleagues and myself, and I can see our quality metrics around preventive healthcare, they are honestly, Peter, the finest that are in the city. And that's simply because we have the opportunity to spend more time with our patients, get to know them inordinately well, and help take them through the path of making sure that they're getting done what they need to get done to help prevent disease in the first place.
Yeah. Ned, are demographics, kind of the aging of our metropolitan Boston, has that changed healthcare in general and in your practice in particular?
I really think it has. It is a challenge that we see at the level of the healthcare system, where the thesis is a different thesis. We're hearing different things than we were hearing as recently as a decade ago. The vernacular within the healthcare systems is to practice at the highest level of your license. And so the way that manifests is, in large part, a lack of continuity of care. So if you're a patient and you're going to a hospital-based or even a large primary care practice, often you will see a physician assistant or a nurse practitioner. And I want to make sure I'm clear about this. A nurse practitioner, certainly the nurse practitioners that I've worked with and the physician assistants I've worked with, provide superb care. With that said, you're not going to likely see your own physician for something which is not deemed to be urgent or serious. So as the demographic and the number of providers further becomes diluted among the population, the vernacular is population health management and population-based medicine. And that's completely understandable given the statistics that we see. But in fact, it's the antithesis to the personalized medicine and the personalized medical framework for which you receive your care.
That's fascinating. So Ned, how does someone that's interested in hearing more about this personalized medicine model, concierge medicine, whatever we want to call it, how do they gather information? Who do they talk to? How can they find a doctor that might be accepting new patients?
It's actually, Peter, believe it or not, that has become a challenge. But what I would say is word of mouth. If you have a friend who has a personalized healthcare physician, probably the best way would be to have an introduction through your friend to that person. In our model, my model, the model that we've adopted, which is MDVIP, you would go to mdvip.com. MDVIP is the world's largest provider of personalized healthcare, and they have a well-oiled machine that will help most everybody find this kind of care if that's what they desire.
Yeah, I think I've heard that that's a challenge. Thank goodness I teamed up with you a long
Early
time
on.
ago, early on. So I'm thankful for that. Ned, so you told us what your goal is to keep people healthy physically and emotionally. And, just as, again, this is my impression, you do that by listening, by spending a lot of time with them, asking a lot of questions. And I'm pretty certain your patients, like myself, value the service and advice and are just willing to pay that modest fee. And it really is a modest fee for that access. And I understand the model, and I value what I get, and therefore I'm willing to pay for it. And your specialty is primary care, but you certainly refer your patients to best-in-class specialists in the Boston area. So, I look at this, I say, we have a lot in common. I believe our clients at the Raskin Planning Group value our service and advice and are willing to pay that modest fee. And we also refer them to other professionals like attorneys and accountants and mortgage specialists and stock and bond investment managers and so on and so forth. So our clients and your patients have something in common. They value service and really that attention to the detail. I don't know if I've told you this, Ned. I don't think so. But over the years, I've actually bumped into a lot of my existing clients in your waiting room. And to me, it's just evidence that, we work with similar kinds of people those people value good advice, good service, and want someone to be there when they call.
Exactly.
So thanks so much, Ned. This has been fabulous. I'm so glad we got a chance to talk. I think the information is really important for people to hear, that there are other models. The business of medicine is so very complicated, and if you're healthy and you don't need a lot, then it just, it doesn't seem very complicated. But if all of a sudden there's something that chronic occurs, something that's serious, you want that best team in place. You want people like you to help manage that process. So thanks for all that you do, and thanks for all that you've done.
Thank you so much for having me on, Peter.
Oh, sure. My pleasure.
Guys, this is fantastic. I got to be honest, it was so interesting to me. Ned, as you were speaking, I had a flashback. I had this memory that was just buried deep inside from years ago of Doc Baker. Do you know who that is?
No, I don't.
Doc Baker. That was the doctor on Little House on the Prairie. I loved that show when I was a kid, right?
Yeah.
But Doc Baker knew every family. It was personalized care, obviously house calls, horse and buggy and all that stuff. I'm sure you're not taking a horse and buggy. However, what I'm hearing is it's almost like a throwback to how medicine used to be. Spending that time with the family, spending that time with a patient. I know that doctors are incredibly busy, and I echo Peter's sentiments when we say thank you to all those frontline workers. But I've never heard of the model that you've described here today, and I'm just blown away. But that was immediately flashed in my mind was Doc Baker and how personal he was with every family, knew everybody, and sat down, and broke bread with them on occasion, and just had discussions. And so I had to say that because I thought it was phenomenal that what you're doing is really going back to the old school way where doctors knew their patients that well, that, they knew the family that well. So I applaud you. I thank you so much for being on the show. Peter, again, you're making connections with me and bringing up memories that are just fantastic. I always bringing in great guests. So thank you so much for doing that. And of course, our last thank you goes to you, the listening audience. Thank you so much for tuning in and listening to the Wealth is in the Details podcast with Peter Raskin. If you have not subscribed to the podcast yet, please click the subscribe now button below. This way, when Peter comes out with a new podcast, it'll show up directly on your listening device. This makes it much easier to share these podcasts with your friends and family. Again, thank you so much for listening today. For everyone at Raskin Planning Group, this is Eric Johnson reminding you to live your best day every day. And we'll see you next time.
Thank you for listening to the Wealth is in the Details podcast. Click the subscribe button below to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Lincoln Financial Advisors Corporation. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. Peter Raskin is a registered representative of Lincoln Financial Advisors. Securities offered through Lincoln Financial Advisors Corporation, a broker, dealer, member SIPC. Investment advisory services offered through SageMark Consulting, a division of Lincoln Financial Advisors, a registered investment advisor. Insurance offered through Lincoln affiliates and other fine companies. Raskin Planning Group is not an affiliate of Lincoln Financial Advisors. Lincoln Financial Advisors Corporation and its representatives do not provide legal or tax advice. You may want to consult a legal or tax advisor regarding any legal or tax information as it relates to your personal circumstances.